Hi, my name is Selena Pauling and I'm a student at Kutztown University. Today I am doing a presentation of my research with the title being The Effects of Marijuana Use on Teenage Mental Health. When I first got assigned to this project, I knew I wanted to do something related to my major, which is psychology. This was important to me so I could branch out and research something that I am very interested in. Coming to college, I noticed I heard a lot about my peers talking about using this drug. This alarmed me because I knew that the brain wasn't fully developed until the age of 25, and most of us are around the age of 19, 20, 21, 22. This matters because marijuana can alter the functions of a still developing brain, especially when you're experiencing any mental health issues or going through any of those type of things. At first, I started out to research the effects of marijuana in general, but that topic was too wide and it was too much to put into a short research paper. While I was researching, I found that the cause of the use of this drug that was so common was because kids were using it to self-medicate themselves for their mental illnesses instead of going to professional help and getting prescriptions or therapy or anything like that. The two most common mental illnesses that kids this age are going through is depression and anxiety. Teens are starting to get involved in using this drug as early as 12 to 16 years of age, which corresponds to 6 to probably like a freshman in high school. To understand this topic, there's a few terms that are necessary to know throughout this whole process. The first one is major depressive disorder. This is a mood disorder that causes the feeling of sadness and overwhelming loss of interest in a whole bunch of different activities that you normally would be interested in. That could be like playing any sports, an instrument, anything like that, even up to hanging out with friends. Individuals diagnosed with this disorder can have trouble going from day to day and may feel like they need to branch out and do and experience different things to try and help them cope with this issue. There's also generalized anxiety disorder that is a main part of my research paper, which is a persistent feeling of worry that can also affect one's day-to-day activities. In most cases, anxiety and depression can go hand in hand, so it can be really hard for individuals to go through this. Uneducated teens may think using this drug is a good way to numb themselves to be able to cope, but essentially it's not really doing them any good in the long run. It is also important to know what marijuana is. That is the main drug that we're talking about in this research paper. Other names for this drug is weed or bud. It comes from the cannabis plant, which has mind-altering compounds. The two active ingredients are THC and CBD. THC is a substance that gets an individual high, and then CBD is the ingredient that acts as an elixir to treat symptoms and makes a person relaxed. In my research, I found a mix of positive and negative results. If a person has anxiety, for example, and they start using this drug, they may experience more panic symptoms, which wouldn't be good for their case. The drug in itself can increase one's heart rate and blood pressure and can also make one feel paranoid. So if you're using it for anxiety, it's not going to help anything with that sense. All of these symptoms combined can lead to a panic attack, which is not what you're looking for when you're trying to get rid of these symptoms. There were some studies that were found that said that marijuana in the short term, if you're only using it every so often, it can help with your symptoms with anxiety, but it's not recommended. And then for people with major depressive disorder, using this drug over time can actually make their symptoms worse. This drug can have the ability to alter their psychological neurodevelopment of adolescent brains, which affects the personality. But on the other hand, since marijuana can act as an elixir, it can actually cause relaxation and stimulation, but only if you're using it in a little quantity. This would be beneficial for adolescents who find it hard to go from day to day. Doing activities, going through school can help them complete their work and get things done throughout the day. But overall, all of these conclusions are all case by case. It is not suggested that adolescents take part in using this drug to help them with their mental illnesses. This is because it has the effect that it can alter the brain and may cause symptoms of anxiety and depression to increase. In contrast, in other situations, it proves that it can reduce feelings of anxiety and sadness, and it's best to talk to a doctor and see what is best for oneself. And that is all that I've concluded through my research of how marijuana affects the teenage mental health.